Welcome back. The Democratic Alliance is calling for Gauteng Health MEC Nomathemba Mokgethi to be fired. It says she failed to probe corruption allegations made by whistleblower Babita Deokaran before she was murdered last year. An exposé by News 24 revealed the slain whistleblower flagged millions of rand in wasted expenditure at Tembisa Hospital. The DA says suspending the department's CFO and the Tembisa Hospital CEO is simply not enough. The party's Jack Bloom joins me now for more. Thank you very much, Mr. Bloom, for your time. So the Gauteng Premier doesn't believe that it's necessary to remove an MEC every time there are challenges within the Department of Health, but you're saying that there's more direct culpability here.
Well, absolutely. I think we need to look at direct political accountability. Two senior officials have been suspended and there's going to be an investigation process. But in the case of political accountability, I think the MEC clearly failed in her job. The late Babita Deokaran was murdered a full year ago. You would have thought that the MEC would insist that any correspondence that Babita had with other officials concerning fishy transactions. We all knew that she was a whistleblower and was probably murdered because of what she had uncovered. So surely the first thing you do in that case is find out what was she worried about and investigate it fully. So not only did senior officials seem to just cover up the whole matter, the MEC herself went along with it. Now, I think that's a massive political failure, and frankly, that's the prime reason why she should be fired.
So earlier this week, you questioned the Gauteng Health MEC, Nomathemba Mokgethi, in the Gauteng legislature, and she claimed that Babita Deokaran had made no formal request for a forensic investigation into those dodgy payments. And that's what you're speaking about, is that trail of communication from Babita Deokaran, that should stand alone and be on its own enough without a formal request. But is it enough to hold the MEC politically accountable? Do you think that your cries for her to be fired are going to be heard?
Well, I gave her the opportunity earlier this week in the Gauteng legislature to explain herself, and she frankly just refused it with this threadbare excuse that there was no, quote, official request from the late Babita Deokaran. Now, there were emails that she sent, there were WhatsApp messages that we sent. The only reason we're getting a proper investigation now is because private journalists, particularly News 24, have done the investigation for the department. Now, if they hadn't done it, nothing would be happening. So I think that's a severe indictment. The fact that the MEC ducked all my questions this week, I think shows that there's something to hide. I also made mention that SANCO, the SA National Civic Organization, which is an alliance partner of the ANC, in June this year accused her of being the mastermind behind corrupt payments by Tembisa Hospital. Now, I think that all the signs were there that something was seriously wrong at Tembisa Hospital. It really should have been thoroughly probed. The officials didn't do their jobs. They've now been suspended. I think that the MEC didn't do her job and she should be fired. That's what accountability is all about.
So simply not doing your job and not investigating is one thing, but you're also saying that you think there could have possibly been a cover-up on her part. Is there any proof at this stage to warrant such claims?
Well, she went along with the CFO, the chief financial officer, who didn't do a thorough probe. I think that she was delinquent in not insisting on a proper probe. Now, whether it amounts to an absolute cover-up, well, I think the fact of the matter is that the investigation wasn't done. Let's just see how serious this is. This was a conscientious official who was doing her job, who was blowing the whistle on corruption. She was trying to stop corrupt payments by Tembisa Hospital, and she was murdered. I mean, if you're the political head of that department and you don't take it sufficiently seriously to make sure that there is justice for Babita, that there's a proper investigation, and most importantly, get rid of all the corruption in that department. I mean, people are suffering in our hospitals because of massive wastage and corruption, and you're the head of the department. You know, I said it's the prime reason for her to be fired right now, but quite frankly, you know, the MEC is a failure as far as providing decent treatment to our patients in hospitals. The department is a shambles, and people are dying in our hospitals because money is wasted, corrupt payments are made, and they still haven't fixed up that department. Now, that is the accountability that we need, and that's really why she should be dismissed pronto.
Well, I'm very glad you're getting to the bigger picture, because Gauteng hospitals have been in the spotlight for a while now. And the problems aren't limited to just one facility. Just looking at Kalafong and the drama playing out there today is proof that there are serious, deep-seated issues. But the problems span many years, many MECs, and even a couple of health ministers. So what do you think is at the heart of Gauteng's health crisis? Because it's definitely not just one MEC.
Well, you know, can I give another example? This department spent R500 million, 500 million rand, on a hospital in the far West Rand that was supposedly donated by Anglo Ashanti Mine to help with the COVID-19 pandemic. In fact, it turns out that they never ever had a valid lease for this hospital, but that didn't stop them. They went and spent R500 million on this hospital, which treated a grand total of 149 COVID patients. It was opened with great fanfare by the Premier of this province in May last year, and now they've abandoned it. After spending R500 million fixing up the hospital, they've said we've got no further use for it, and that's it. Now, you know, to just walk away from this massive waste of money is just unbelievable. And I can tell you other examples of wasted money. And one must understand that we have cancer patients in our hospitals that are dying because we don't have you know, proper machinery to treat them. The waiting lists are long. And the other scandal, quite frankly, is the fire at the Nomathemba Johannesburg Hospital. We still don't have the report on why this fire occurred, and if there was, you know, if there was criminal motive behind it. You know, there's so much that is going wrong. The fact of the matter that Nomathemba Johannesburg Hospital has not been speedily repaired is another scandal all of its own. So I think there needs to be a thorough cleanup in that department, starting at the very top. Needs a decent health MEC. It needs, I think, competent, honest people at all levels. Now they don't have a chief financial officer who's been suspended in the midst of the scandal. The previous chief financial officer also had to resign because of the PPE scandal. It just goes on. And what it says to me is that the rot in that department is still there. The current MEC has been in there for more than a year and a half, and she's failed to do anything to clean it up. So, you know, I think she must go.
Thank you very much for your time. That was the DA's Jack Bloom saying that the Gauteng Health MEC Nomathemba Mokgethi should be fired.